Dear friends, I am coming to you today to speak about a very important subject close to my heart, which is the health and well-being of the population of the United States. As I am a physician and medical provider, by way of background, I am a internist, cardiologist, and vascular specialist practicing in Fresno, California. My name is Sanjay Srivatsa. I practice in this country and trained in this country now for almost 25 years. Prior to that, I was a board-certified internist in the United Kingdom and grew up in the medical community of the United Kingdom and the United States for equal proportions of my life. I'd like to share some reflections. I did train at some of the finest establishments both in the United Kingdom and the United States, including the University of Cambridge in England and the Mayo Clinic here in Rochester, Minnesota. I say this only to inform you that I have seen all aspects of medicine, from the very finest technology and services down to what's available in rural areas. I have lived in 10 states of the United States. I have practiced in large and small groups. I have been part of specialist groups, and I've been part of a practice that involves practitioners, including internal medicine, family practitioners, surgeons, multi-specialty groups, in fact. So I've seen the whole gamut of medicine. We are faced today with a grave situation. The insurance coverage for people of limited means or no means in this country has fallen to such a desperate level that we have little or nothing to offer some of these people who are in dire crisis for their health. As you know, the current administration proposes to scrap all the recent gains provided to us by Obamacare. This, in my view, is a retrograde step which will lead to catastrophe and nothing short of catastrophe in many parts of the United States, and especially where I live in the Central Valley of California. In essentially all of the states, from Sacramento, the capital, down to San Diego in the Central Valley, have upwards of 40, 50, even 60% of the entire population on some form of Medi-Cal or managed Medi-Cal. In California, Medi-Cal is the term utilized for Medicaid, so you understand the terms involved. Frequently, states choose not to administer the vast proportion of these Medi-Cal programs, but in essence licenses them out for management by third-party companies who manage them for a profit. What this means is that whatever limited money is available is then administered by a third party, essentially for profit. By the time the bone gets down to the patient, there's very little meat left on it, simply because of the way in which the whole healthcare system is managed on a for-profit basis. I have heard many arguments as to why Obamacare should not be allowed to continue. There are definitely good arguments for inefficiencies, and there are certainly great weaknesses in the program. But one thing is incontestable, and that is that since Obamacare was introduced, we have seen a vast number of people with no insurance being provided insurance for the first time. In my town of Fresno, greater than 60% of the population is non-Caucasian, speaks at least 4 or 5 disparate languages, with the largest proportion being Hispanics. But we have many others, including Hmong population, Punjabi population, and several other disparate Chinese, Filipino, and Japanese populations here. Many of these people are poor. Many do not have access to regular insurance and perform jobs which are part-time or seasonal, and therefore have no access either financially or through their company for any kind of coverage. This leads to these patients being essentially serviced through the hospitals and essentially through the emergency room. It's catastrophic care, and it's too little, too late. Nobody manages their chronic medical conditions, and if we see Obamacare scrapped, the people most vulnerable, the people with mental illnesses and handicaps as well as disabilities, will be the first to suffer. This country fought 2 wars of independence and then a civil war for civil rights, which resulted in a country that was independent, founded on democratic principles, where all men were treated equally, and got rid of the evil of slavery. I'm sure we hear all the time that it is impossible to have universal health care because it's too expensive, because too many people will obstruct it, because not enough politicians can get together to pass it, and if it cannot be passed, it therefore must not be worth discussing. If it might amount to a lot of money, it might not be worth discussing. So how much is a lot of money? We can talk about billions and trillions, but in essence, when we put this into perspective, we have to ask ourselves how much the United States spends in a rocket program, a space program, preventing famine and disasters and relieving them overseas, all of which is appropriate. I just posed the question, is it not a fundamental right of United States citizens to have clean water, education, the right to self-determination and suffrage, and finally, the right to health? It's so fundamental that to deny every citizen some form of minimal health care is, in my opinion, a travesty of all the principles the Founding Fathers stood for. This is why I'm asking you to support the initiative made by Senator Bernie Sanders for universal health care. Not because I necessarily vote for him or the Democratic Party, but because I believe it's a concept worth supporting. I'm not asking you to do it for any other reason. He is worth listening to. I do happen to believe he's a man of principle, and I believe that he's not motivated by personal or financial gain as many other politicians are today. He does not resort to mob incitement, for want of a better word, to gain his political advantage, but relies on reasoning. Please listen to the reason why universal health care is worth supporting. I saw universal health care in the National Health Service when I was training and when I practiced as an internist in the United Kingdom, going back to 1990. At that time, the National Health Service in England suffered from a great deal of problems. Inefficiencies of care, long waiting lists, poorly managed hospitals, inadequate technology, etc. But one thing was for sure. If today, I as an American citizen were to land in Heathrow and have a heart attack, nobody would ask me my insurance. They would just treat me at a United Kingdom hospital closest to my location. It's for these reasons that I continue to believe that universal health care of the kind provided in other countries can be achieved in our country and should be achieved in our country. It is our right, and it is the right of all citizens to have some form of health care. We cannot ask people to save for this. We cannot say that people have disabilities brought on by their poor living, drinking, smoking. Who shall we blame next? That they should have chosen their parents better, and that they could have had a better genome which didn't result in diabetes or blood pressure? We're all in this boat together. We all have to paddle. Let's help everybody out, and let's support a great idea. Universal health coverage. I support it wholeheartedly, and I tell you, it is our only way forward. Thank you for your attention. I am eager to hear your comments.